Hi, I am Dr. Wu Li. I am reading Chinese book. The name of Chinese book, 针灸临症指南. In English, acupuncture moxibustion clinical guide. I am reading Chinese clinical book, guidebook, and learning and studying. 针灸临症指南. Today中风三期治各有方，治各有方，中风三期治各有方。
中风三期治各有方。
3 stages of stroke, different treatments.
When we do treatment, we can divide 3 stages of stroke. Also, each stage different treatment.
Xiàoshǎoqīng南京中医学院。
Xiàoshǎoqīng Surname Xiao. First name Xiàoqīng. 南京中医学院。Nanjing University of Traditional Chinese Medicine.
"我对本病的治法是按照不同症型而进行辨证施治的。
My approach to treating this disease is to differentiate and treat based on different syndrome types.
Divide 3 stages. Treat based on different syndrome type.
中风前驱期 可见头痛头胀，头重脚轻，步履漂浮，甚则指端不时麻木，舌强言语不利，头晕、目眩等症，此为中风预兆。
取为中风预兆，中风前秋期。
中风前驱期，可见头痛头胀，头重脚轻，步履漂浮，甚则指端不时麻木，舌强言语不利，头晕、目眩等症，此为中风预兆。
During the prodromal stage of a stroke, symptoms include headache, swelling of the head, heaviness of the head, lightness of feet, unsteady steps, numbness of the fingertips, stiff tongue, difficulty speaking, dizziness, etc. These are signs of a stroke.
During the prodromal stage of a prodromal stage of a stroke, symptoms, headache, swelling of the head. Swelling of the head is not real swelling, feels like swelling feeling. Heaviness of the head, unsteady steps, even worse, numbness at the fingertips from time to time. Numbness at the fingertips and stiff tongue, difficulty speaking, dizziness, like vertigo. These are signs of a stroke. What signs of stroke are there? Headache, feeling swelling of the head, heaviness of the head, step unsteady, numbness at the fingertips, stiff tongue, difficulty speaking, and dizziness. These are signs of a stroke.
于治平肝前阳方píng qián fāng， 乃取百会、风池、曲池、合谷、阳陵泉、三阴交、太冲、毫针刺，用泻法，留针30分钟，每隔10分钟行针1次，每日施术1次，一般针3到5次，便可取效。
平肝占阳方占牵阳方前平肝牵阳方平肝calm liver calm down liver 前阳前 emerging yang energy 平肝前阳放
于治平肝前阳方píng qián fāng 乃取百会、风池、曲池、合谷、阳陵泉、三阴交、太冲、毫针刺，用泻法，留针30分钟，每隔10分钟行针一次，每日施术一次，一般针3到5次，便可取效。
I have formulated the píng qián yáng fāng, which uses fine needles to prick Baihui, Fengchi, Quchi, Hegu, Yanglingquan, Sanyinjiao and Taichong points, using the purgation method. The needles are retained for 30 minutes, and the needles are moved once every 10 minutes, once a day. Generally, 3 to 5 times of acupuncture are required to achieve the desired effect.
Formulated 平肝前阳方that is calm down liver and 前阳diminish high active yang, emerging high active yang, use fine needle point Baihui Fengchi gallbladder channel, govern channel, Quchi, hand Yangming, 大肠经 large intestine, Hegu, large intestine, Hegu, 阳陵泉 foot 小样 gallbladder 阳陵泉 Sanyinjiao stimulate in energy, and Taichong liver calm liver point. Using the purgative method, needles retained for 30 minutes and needle moved once every 10 minutes. Once a day, generally 3 to 5 times of acupuncture are required to achieve the desired effect.
若因年高气虚所致者，可灸百会、风池、肩颈、曲池、风市、足三里、绝骨诸穴，亦有较好的预防作用。
If it is caused by qi deficiency due to old age, moxibustion on Baihui, Fengchi, Jianjing, Quchi, Fengchi, Zusanli and Hegu acupoints can be used, which also has a good preventive effect.
If someone caused by qi deficiency due to old age, at that time qi deficiency, so use moxibustion on Baihui, Fengchi, Jianjing, Quchi, large intestine, Quchi, Fengchi, gallbladder, Fengchi, 93里, stomach, and 绝骨 gallbladder point can be used. Good preventive effect.
«足中期，其症形有痹、脱之分。痹症宜开，脱症宜固。
In the middle stage of stroke, the syndrome is divided into closed and loose. The closed syndrome should be opened, and the loose syndrome should be fixed.
Syndrome divided into two one is closed syndrome. At the time we need open, and the other one loose syndrome. Loose means empty, all energy out, yang energy all out, loose syndrome. In this, at that time we need fill back, recharge back, and make it fix without shaking. Fixed, strong, make it strong.
前者于治开窍息风方，乃取水沟追垢，12井筛而进，太冲，风龙，风池太，百会毫针刺，用泻法，留针30分钟，每隔10分钟，行针1次，每日施数1到2次，可起平肝息风、清火或痰、开窍起闭之功。
For the former, I made a prescription for opening the orifices and extinguishing wind, which uses fine needles to prick the Hegu, Shijing, Taichong, Fenglong, Fengchi, and Baihui points. Using the drainage method, the needles are retained for 30 minutes, and the needles are moved once every 10 minutes. The procedure is performed 1 to 2 times a day, which can calm the liver and extinguish wind, clear fire and eliminate phlegm, and open the orifices and close the orifices.
The former that is closed syndrome. For opening the orifices, the prescription is opening the orifices and extinguish wind. The name of prescription opening the orifices and extinguishing wind. Take Hegu, 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 Xiàoshǎoqīng 12 fingertip bleeding. 12经 fāng to reduce flame. Fengchi goblet. Baihui, and use fine needles. Use drainage method to open the channel. Leave the needles for 30 minutes, and every 10 minutes move the needle in and out and twist. One to two times a day, so calm the liver and extinguish wind, clear fire, and eliminate flame, and open the orifices, and close the orifices.
For the former, I made a prescription for opening the orifices and extinguishing wind, which uses fine needles to prick the Hegu, Shijing, Taichong, Fenglong, Fengchi, and Baihui points. Using the drainage method, the needles are retained for 30 minutes, and the needles are moved once every 10 minutes. The procedure is performed 1 to 2 times a day, which can calm the liver and extinguish wind, clear fire and eliminate phlegm, and open the orifices and close the orifices.
Open the orifices and there are two syndromes: closed syndrome and lose syndrome. All energy run out, empty syndrome. At closed syndrome, the prescription is opening orifice and extinguish wind. How can we open orifice and extinguish wind? The point Hegu, 런종, middle, Hegu, open, middle, Hegu, 12징, 12 finger tip, and Taichong, liver, open liver channel, Taichong, Fāng, gallbladder channel, remove phlegm, reduce phlegm, Fengchi, open the channel, gallbladder channel to the head, Fengchi, and Baihui means 100 meet together. All meridian meet together. Point Baihui. Use drainage method. Leave needle 30 minutes. Drainage method and fine needle. Retain 30 minutes, and every 10 minutes stimulate, move the needles. One to two times a day. So with this, calm the liver and extinguish wind. So we understand stroke affected by liver wind. In our body, wind produced by liver. When the liver yang, high active, couldn't control, liver in couldn't hold liver yang, so liver yang high active, so goes up to the head and blood pressure going up. So for the first of all, we need to calm the liver. To calm the liver, open the channel. So we can use Taichong liver channel, directly liver channel, and Fengchi gallbladder channel. When closed syndrome, we need to open orifice. The principle of treatment extinguish wind, opening the orifice and extinguishing wind. So calm the liver and extinguish wind and clear fire, 清火, clear fire, clean, extinguish fire, and eliminate flame. To eliminate flame, we use fāng point. So can open the orifice and extinguish wind.
对后者则摄回阳固脱方，乃取关元、气海、神阙、隔盐酒，加大艾注久之，不拘壮数，久至汗收，知温，脉起为度，可奏回阳固脱之效。
For the latter, a reviving Yang and Gutuo prescription is designed, which is to treat guanyuan, qihai, and shenk, moxibustion with salt, increase the size of the moxa cone, and moxibustion without being restricted by the number of times. Moxibustion should be continued until sweating stops, limbs are warm, and pulses rise. This can achieve the effect of restoring Yang and Gutuo.
Fixing loose. For the latter, loose symptom. All energy, especially fundamental yang energy, run out, empty, like a battery gone. At this time, we need reviving yang, and fix Gutuo Hegu to fix loose prescription. Google Translate couldn't translate this. Fix losing loose prescription. Reviving yang and fix loose prescription. The point we can use Guan Yuan on the belly button, Guan Yuan, Qi Hai, Guan Yuan, Shen Cui, belly button, Shen Cui. Here, moxibustion with salt. Lay salt and fire over the salt. Increase the size of the moxa cone. Make it bigger. And moxibustion without being restricted by the number of times. There are not restriction the number of times. Moxibustion should be continued until sweat stops. Sweating without energy, without Wei Qi, Yang Qi, Yang energy. So once we recharge, reviving Yang energy, sweat stop, and limbs are warm. Limbs are getting warm, and pulses rise. Pulses getting powerful. Should be continued until sweating stops, limbs warm, pulse rise. So restoring yang and fixing loose. Restoring yang, so fixing loose. Zhong Jing Luo Zhe, affected meridian. If someone affected meridian,
见口眼乖斜，舌强不语，半身不遂等症，于用舒筋活络方，舒筋活络方 dredging the meridians and activating collaterals.
The prescription 输 dredging meridian 活络 real life reviving activating 络经络 means branch collaterals. Jing is more big main stems in our meridian. Luo is branch from the Jing, so more thinning vessel. It's like a capillary. So activating capillary collaterals.
Seeing symptoms such as facial paralysis, tongue stiffness and inability to speak, and hemiplegia. I used the Shujing Huoluo formula, Shujing Huoluo Fāng, dredging the meridians and activating collaterals.
Facial paralysis, tongue stiffness, inability to speak, and hemiplegia. At that time, what prescription? Shujing 活络 prescription. Shujing means dredging meridian. 活络 real life, collaborate. Activate, collaborate, like a branch vessel, branch line, like a capillary line.
« 乃取肩盂，曲池，合谷，环跳，足3里，绝骨。
Take qián, Quchi, Hegu, Huantiao, Zusanli, and Hegu.
Take 肩盂 shoulder, top of the shoulder. 肩盂 could be large intestine. Show Yangming, hand Yangming. 曲池 hand Yangming, activate hand Yangming. So activate Yang. Hegu also show hand Yangming. Hegu 曲池肩盂 含跳 foot 小阳 foot 小阳横跳足三里 foot 阳明 foot 阳明 stomach 足三里绝骨 foot 小阳 foot 小阳 so open this channel 阳明 hand 阳明肩위曲尺合谷 activate reviving Yang method use 阳明 point 横跳足三foot 阳明 double 两阳明 means double 两横跳绝骨阳个阳小阳绝骨 foot 小阳
获取监疗配14手3里历时外观 T15 风市阳陵泉昆仑等穴以治偏瘫为主
or can take 监疗hand 小阳三角小阳手三里 also large intestine 外观 hand 小阳外观风湿 gallbladder 风湿阳陵泉 also gallbladder foot 小阳阳个阳小阳阳陵泉库论 foot 太阳
or take Yanglingquan Te14 Shusan Li Li10 Weiguan Te5 Fengchi Yanglingquan Kunlun and other acupoints to treat hemiplegia.
「口眼咽血者，则加地仓透夹车，阳白瞳孔直上，眉上1寸透于腰在额部，瞳孔直上，眉毛中，或听会透一风，太阳眉梢与目外眦之间。向后约1横指的凹陷处透全疗。
mouth, eye, thorough, oblique. Taichong to penetrate 驾车 from 地仓 to 驾车
For those with oblique mouth, eyes and throat, add dekang, penetrate jiash, yangbai, directly above the pupil, 1 inch above the eyebrow, penetrate yuyao in the forehead, directly above the pupil. In the eyebrow, or tinghui, penetrate yifeng, between the end of the eyebrow and the outer canthus of the eye, penetrate the yanliao in the depression about 1 horizontal finger backward.
If the mouth, eyes, and throat are oblique at the time, from 地长 to 驾车 地长 penetrate from 地长 to 驾车 the other one 杨白 to 鱼咬 杨白pupil above the pupil 1 cone above eyebrow. Yangbai directly above the pupil 1 inch above the eyebrow. From Yangbai to penetrate 鱼咬
For those with oblique mouth, eyes and throat, add dekang, penetrate jiash, yangbai, directly above the pupil, 1 inch above the eyebrow, penetrate yuyao in the forehead, directly above the pupil. In the eyebrow, or tinghui, penetrate yifeng, between the end of the eyebrow and the outer canthus of the eye, penetrate the yanliao in the depression about 1 horizontal finger backward.
Kou Yan or Kuai Xie, that is deviation of mouth and eyes oblique. Di Chang to Jia Che, Di Chang penetrate to the Jia Che. The other one is Yangbai, from Yangbai. 양발 above the eyebrow, above the 양발, where that is directly above the pupil 1 inch, 1천 above the eyebrow, 1천, not inch, 1천. 원천 above the eyebrow, that is 양발, from 양발 to 위아오, penetrate, from 양발 to 위아오. 위아오 is in the forehead, directly above the pupil. 위아오, directly above the pupil in the eyebrow. 위아오, just directly above the pupil in the eyebrow. Or from 팅회, our ear, 팅회, from 팅회 penetrate 이펑, behind of the ear, 이펑. And from 타양 to 얀liao, 타양. From 타양, that is between the end of the eyebrow and the outer canthus of the eye. 타양, that is end of the eyebrow and the outer canthus of the eye, between eyebrow and eye, that is 타양. To 옌려. 太阳 point between the end of the eyebrow and the outer canthus of the eye, in the depression about one horizontal finger backward. That is Taiyang point location. Taiyang to Yangliao, Taiyang to Yangliao.
"舌强不语者，则加雅门、连泉、天突、通里，或取连泉透海泉、金津、玉液。
金津玉液，金津玉液。
For those with stiff tongue and inability to speak, add Yamen, Liangkan, Tiantu and Tongli, or take Liangkan, Toikan, Jinjan and Yuya.
For the stiff tongue and inability to speak, we can add Yamen, under the Fengchi Yamen, and Lianquan from Adam apple to the chin, the middle, between Adam apple to the chin and middle. Lianquan and Tiantu and Tongli, Tiantu and Tongli. Or take Lianquan to penetrate, from Lianquan to penetrate Haiquan, Lianquan to Haiquan. That penetrate. From Lianquan to Haiquan, that is inside tongue, inside under the tongue.
"口眼嘛邪之症，宜用透穴补法，是以平补平细，留针30分钟，每日或隔日施术1次。
For cases of facial paralysis, it is advisable to use the method of penetrating acupoints to supplement and drain the affected area evenly, leaving the needle in place for 30 minutes. Once a day or every other day. For cases of facial paralysis, it is advisable to use the method of penetrating acupoints to supplement and drain the affected area evenly, leaving the needle in place for 30 minutes. Once a day or every other day. For cases of facial paralysis, it is advisable to use the method of penetrating acupoints to supplement and drain the affected area evenly, leaving the needle in place for 30 minutes. Once a day or every other day.
舌强不语之症，除哑门不宜深刺和强刺激外，其余诸穴均可深刺和施以泻法。尤其是连泉在喉结上方，当舌骨的下缘凹陷处取穴透海泉至头颈部奇穴，位于口腔内，当舌下系带中点和津津上据点域液，更应深刺、强刺，才能奏效。
For the symptoms of tongue stiffness and speechlessness, except for yamen, which should not be pierced deeply or strongly, all other acupoints can be pierced deeply and with drain. For the symptoms of tongue stiffness and speechlessness, except for yamen, which should not be pierced deeply or strongly, all other acupoints can be pierced deeply and with drainage. In particular, Yanglingquan is located above the Adam's apple, and the acupoint is taken at the depression at the lower edge of the hyoid bone. Toikan is a special acupoint of the head and neck, located in the oral cavity, at the midpoint of the sublingual frenulum and gingiva, and it should be pierced deeply and strongly to be effective.
For the symptoms of tongue stiffness and speechlessness, except for yáng, which should not be pierced deeply or strongly, yáng shouldn't be pierced deeply or strongly. All other acupoints can be pierced deeply and with drainage. In particular, Yanglingquan is located above the Adam's apples, and the acupoint is taken at the depression at the lower edge of the hyoid bone. From Yanglingquan to Haiquan, penetrate to Haiquan. From Yanglingquan to penetrate to Haiquan. Special point. Haiquan is a special acupoint of the head and neck, located in the oral cavity at the midpoint of the sublingual frenulum 进进进进愉悦愉悦愉悦进进愉悦 left 进进 right 愉悦 under the tongue should be pierced deeply and strongly to be effective.
For the symptoms of tongue stiffness and speechlessness, except for yamen, which should not be pierced deeply or strongly, all other acupoints can be pierced deeply and with drainage. In particular, Yanglingquan is located above the Adam's apple, and the acupoint is taken at the depression at the lower edge of the hyoid bone. Toikan is a special acupoint of the head and neck, located in the oral cavity, at the midpoint of the sublingual frenulum and gingiva, and it should be pierced deeply and strongly to be effective.
恢复期对上述半身不遂等症，除宜用舒筋活络方外，还可结合水针疗法，用50%安酪酸 （N-Lo-Suan gamma-aminobutyric acid）。GABA is a chemical messenger in the brain and spinal cord that slows down nerve impulses. It's known for its calming effect and is thought to help with anxiety and stress. 1.5毫升注入并侧风池穴，或用三磷酸腺苷 adenosine triphosphate (ATP) in biochemistry. It is a nucleotide that acts as a molecular currency for energy transfer within cells, storing and transferring chemical energy. 也称作腺苷三磷酸、腺嘌呤核苷三磷酸。乐生物化学中是一种核苷酸，作为细胞内能量传递个分子通货，储存搭传递化学能。三磷酸腺苷三磷酸 qián 的 glucose-bisaidudate 10到20毫克注入并侧风池穴。后期用维生素 B 100毫克加50毫烟酰 niacinamide 等于 nicotinamide acylcysteine qián 胺 and amine Quchi SSO 注入并测风池穴，每日或隔日施术1次，10次为1疗程，收效奏佳。
During the recovery period, in addition to the Shujing Huoluo prescription for the above-mentioned hemiplegia, water needle therapy can also be combined. Using 50% aminobutyric acid and Lauan gamma-aminobutyric acid, GABA, is a chemical messenger in the brain and spinal cord that slows down nerve impulses. It's known for its calming effect and is thought to help with anxiety and stress. 1.5 milliliters injected into the Fengchi point on the affected side, or adenosine triphosphate ATP. In biochemistry, it is a nucleotide that acts as a molecular currency for energy transfer within cells, storing and transferring chemical energy. Also known as adenosine triphosphate. Adenosine nucleoside triphosphate is a nucleotide that acts as a molecular currency for energy transfer within cells, storing and transferring chemical energy. Adenosine triphosphate, 10 to 20 milligrams of B-adenosine triphosphate, is injected into the Fengchi acupoint on the affected side. In the later stage, 100 milligrams of vitamin B and 50 milligrams of nicotinamide, niacinamide equals nicotine amide, acylsaon, qián, are injected into the Fengchi acupoint on the affected side. The treatment is performed once a day or every other day, and 10 times is a course of treatment. The effect is good.
"在治疗偏瘫期中，可配合推拿、电兴奋、体疗功能锻炼等方法，以加强疗效，对缩短病程、加速康复很有裨益。"
During the treatment period of hemiplegia, massage, electrical stimulation, physical therapy, functional exercise and other methods can be used to enhance the therapeutic effect, which is very helpful for shortening the course of the disease and accelerating recovery.
Very beneficial. Case study.
曾志金某，男，56岁，家属代述，素有高血压病史，经常头晕发胀，手指发麻。1年半前，突 突然昏仆，不省人事，口眼向右侧歪斜，不能讲话，左半身肢体偏瘫。
Zheng Shijian, male, 56 years old. Family members said, he has a history of hypertension, often dizzy and swollen, numb fingers. 1.5 years ago, he suddenly fainted, lost consciousness. His mouth and eyes tilted to the right, he could not speak, and his left limbs were paralyzed.
经当地医院诊为中风，脑血栓形成，通过服中药结合针灸，左侧上下肢运动功能逐渐恢复，为报案难言，已历年半。贺诊患者面容憔悴，舌缓不语，谈吐稠黏，舌质偏红，苔黄腻，脉象娴静而滑，正属中风失语之后。
谈吐，谈吐。谈吐抽粘，谈吐抽粘。
The local hospital diagnosed the patient with stroke, cerebral thrombosis. Through taking Chinese medicine and acupuncture, the motor function of the left upper and lower The local hospital diagnosed the patient with stroke, cerebral thrombosis. Through taking Chinese medicine and acupuncture, the motor function of the left upper and lower limbs gradually recovered. But he was suddenly unable to speak for a year and a half. The patient looked haggard, his tongue was slow and he could not speak, his sputum was thick and sticky, his tongue was red. His tongue coating was yellow and greasy, and his pulse was stringy and slippery. The symptoms were Zhongfeng aphasia.
Sputum, thick and sticky. Sputum. Sputum, thick and sticky. Sputum. Tongue was red. Red means lost blood, not enough blood. His tongue coating was yellow and greasy. Yellow means some fire inside. Temperature high. And greasy means damp. His pulse was stringy. Stringy means liver pulse. And slippery pulse. There are some many flame in his body. The symptom: 中风, stroke, aphasia, can't speak.
治当平肝化痰，宁心开窍，汲取百会，太冲、3阴交，以平肝潜阳，脾俞、丰隆，以健脾胃而化痰湿，既取心俞、神门、通里、哑门、连泉，以宁心安神而开窍发音。
开窍发音。
The treatment should be to calm the liver and resolve phlegm, soothe the mind and open the orifices. That is, take Baihui, Taichong, and Sanyinjiao to calm the liver and suppress Yang. Pishu and Fenglong to strengthen the spleen and stomach and resolve phlegm and dampness. Then take Shinshu, Shenmen, Tongli, Yamen, and Liangkan to calm the mind and open the orifices to pronounce.
Treatment: calm the liver. Calm the liver. Liver overactive, so overactive at the top of the body. Rise up, so calm the liver and resolve phlegm. And soothe the mind and open the orifice. So take Baihui, Taichong, calm the liver, Taichong liver point, Taichong, and Sanyinjiao, improve in energy, Sanyinjiao, to calm the liver and suppress yang, to suppress yang, increase Sanyinjiao in energy. And Pishu and Fāng, strengthen the spleen and stomach. And Fāng resolve phlegm and dampness. Strengthen the spleen, so spleen can resolve phlegm and improve digestion and transmission. Take Shinshu, Shenmen, Tongli, Shenmen or Tongli, Yamen for speaking, Linquan for speaking, Lianquan. So calm the mind by Shenmen, Shinshu, and open the orifice, Yamen and Lianquan.
君师以身刺，透穴，泻法，留针30分钟。每日针治1次，共针3次。患者顿觉心胸豁然开朗，诸样消失，喉间遂能发音，语言如常。患者及其家属无不欢悦若狂。约3年追访，患者语言正常，上班工作颇感爽适。
Deep acupuncture, Penetrating acupoints and drainage methods were used, and the needles were retained for 30 minutes. Acupuncture was performed once a day for a total of 3 times. The patient suddenly felt that his mind was suddenly clear, all his illnesses disappeared, and he could speak in his throat and speak normally. The patient and his family were all very happy. After 3 years of follow-up, the patient's speech was normal and he felt comfortable at work.
军师以